Could the high numbers in the U.S. be attributed to mass testing? Let us know on Twitter. We'd love to hear from you. But joining me now to answer this is U.S. Ambassador to South Africa, Lana Marks. Ambassador, good evening and thank you for your time.
Thank you, and it's an honor to be on your show. Pleasure to see you.
Looking at the first 100 days of the outbreak in the U.S., putting it at around January the 3rd up until this point, the federal government, how have they responded in terms of what they did, what they didn't do, and what they did ineffectively?
I know from early on, President Trump was attending to this tremendously at the White House. I was there myself. He had all the experts in from everywhere, and he was making a huge effort to get this under control. At the moment, he's given the responsibility to each state in the United States. We have 50 states. He has given them the CDC guidelines to implement themselves, and they each have to consider in a very delicate balancing act between medicine, health, and the economy.
Now, some of the governors have pushed back at that, saying the president and the federal government is passing the buck without passing the bucks, because they have been given this responsibility to decide on the reopening without the necessary financial support as far as the infrastructure and their response is concerned.
President Trump has given them huge financial support in every respect. He personally called every governor in the United States, asked them what help they needed, and gave them immediate help, and they all verbalized this to the media. The U.S. is a very large country, and each state has a very responsible governor to govern that state, and President Trump correctly has delegated this responsibility with his full support of his administration to each of these states.
Well, the New York governor has very strong words. I mean, I'm sure he'll disagree with what you're saying. In fact, Governor Cuomo says the president has done nothing and watched Twitter and television instead of responding to the crisis the people are facing in that state.
Well, I saw the interview that Governor Cuomo mentioned when he thanked President Trump tremendously for all the aid that he had given to Governor Cuomo. There were 400,000 beds expected. President Trump opened up the Javits Center. He sent the military ship, the great big vessel, to New York to assist Governor Cuomo. Governor Cuomo on the media voiced his great approval of what President Trump had done for him.
Now, Dr. Anthony Fauci, who is the leading infectious disease expert in the U.S., has said this: if the states reopen before meeting the criteria set out by the Trump administration, they risk reprisals of the outbreak. Why is there a public disagreement between the leading expert in infectious disease in the U.S. and President Donald Trump at the moment?
There's no disagreement whatsoever. President Trump is absolutely considering what his top scientists are, Ambassador Birx, who's well known by South Africa with the PEPFAR program, and Fauci, and he considers everything before he makes decisions.
The president has said those remarks were unfortunate. In fact, he has accused Dr. Fauci of wanting to be on both sides of the equation.
It's a very difficult situation, and Fauci is being very, very cautious, as he would be as a scientist in that position.
Now, do you believe there was enough contingency put in place, particularly when the outbreak first happened in the U.S., considering that the first case of a traveler is reported to have happened on the 6th of January, but it is only 10 days later that they were actually diagnosed with COVID-19.
President Trump has taken this very seriously, and in January he stopped flights to and from China. Unfortunately, it was only in March 11th that the WHO declared this a pandemic, and unfortunately delayed the response of the United States, who was waiting for this announcement.
But Ambassador, in around February the 5th, the WHO actually gave a full briefing to the United States around steps being taken in Wuhan Wuhan locking down at least 11 million of its people. Why did the U.S. not respond at that time?
Well, the president has legitimate grievances against the WHO. Unfortunately, the whole situation has not been transparent. And what has happened is the WHO has considered global politics ahead of medicine and science.
The president himself was tweeting in February, Ambassador, that he's had transparent conversation with all the stakeholders, including the WHO, including China. In fact, the president in February was praising China for their transparency and the way in which they had handled the dissemination of information and the alerts that they had issued at the time. Why is the president now complaining about transparency?
Well, many more facts have come out since February about what happened in Wuhan in China and subsequent movement of people all over the world. And in February, the president was not privy to all of these facts. And as you know, it was not yet declared a pandemic.
Now, the president citing the WHO as being poor in terms of its reporting and possibly withholding funding to this organization. How is that going to impact on the fight against this virus in Africa and the rest of the other parts of the world that need the support of the WHO?
Well, Secretary Pompeo gave another announcement today in which he said that 160 million would be added to the global fight on funds of the generous American people and the U.S. government for coronavirus 19. And that means to date, the U.S. will have funded $1 billion for COVID-19 to all the countries of the world, despite our situation at home.